and chiropractor, Dr. Gregory Johnson, and today we're going to be doing a established office visit on Greg, who has also come to us with a new version of the Terminator. We're going to call that the Terminator Termination 2 one. So let's take a look in the mirror here. Okay, now I'm going to have you flex your head forward and backwards, and then neutral. So we're analyzing his posture on three-dimensional axes right now, on the x-axis, the y-axis, and the z-axis. And what we're seeing is that he has a little bit of translation forward on the z-axis, so his forward head posture, a little left translation of the cervical spine and the head on the x-axis, so that's raising his right shoulder up a little bit. That is a positive SX cervical. And in the lower back and thoracic spine, it's translated a little bit more to the right, so that's a negative SX thoracic and negative SX pelvis. So, okay, Greg, let's go ahead and have you lay on your back right here for me. His name's Greg, my name's Greg, and my son's name's Greg. So, we're having a great kind of day. All right. And this is Monday, too. Okay, we always lift the patient's legs up to where they're parallel with the floor, so it helps relax the pelvic muscles and the lumbar spine musculature. Now, how long's it been since you've been adjusted? 4 weeks?
Yeah, about that.
About a month since his last adjustment. And what he has noticed is that he's had some reoccurring and return low back pain as well as knee pain, which we saw that structurally had translated to the right, so we know why that's happening. And plus his forward head posture puts more of an increased weight bearing down in his lumbar spine. There we go. Good. Lay it right on back. Now he's really good at this. Just take a breath through your nose. And so am I. So we just pull in there nice and easy. And check out his reflexes, and they're all good. I might have to even pull him one more time on that one. Perfect on the right rotary brake and the left rotary brake. That's a Palmer College of Chiropractic diversified adjustment on the cervical spine. Now, as always, we're going to ask him to roll sideways and come over onto the black table and lay prone for us. There we go. Okay. Now, doing a Deerfield leg check on him, his right leg is short by about 1/4 of an inch. When I bring it up, you can see it's already even, and watch his pelvis raise up in the air right there. That tightened up a little bit right there, Greg?
Oh, yeah.
Right there, yep. So we're adjusting his right sacroiliac first, his sacrum straight S to I, or in the Y-axis as well. Now, L5. You can see I'm doing that straight in the Z-axis. And then his sacrum in the Y and Z-axis. But we're going to be working on his pelvic musculature, which right here is his gluteus medius and maximus. And I'm going to do that with my elbow first. And then we're going to get down into the deeper piriformis muscle, which goes from his actual hip joint to the middle triangular shaped bone in the sacrum. And then right here, and I call the pocket, right, the base of the spine, where the paraspinal musculature attaches to the sacrum itself. There we go. Excellent. And now just breathe normal for me. There we go. You see the axis I'm adjusting is much greater superior to inferior down there as we move up in the thoracic spine. We change the angles according to the facet joint, which is the actual joints that hold the spine up. And right down there at T12L1 is a very important area. Now, look at the difference in the Terminators. You can see the Terminator that Greg just built is much bigger than the one that I had previously. So we're going to be using the larger termination salvation model first. Same principle. When you get right on the trigger point. Yeah, it actually works good. I like it. And same thing here on the paraspinal musculature. Maybe this might look like torture to some of you, but this is one of those really good hurts, isn't it? Now into the hamstrings. Good. Good. Excellent. By the way, that worked great, Greg. I think we're going to have a big market for that. And any of you that are interested in the Terminator, just leave them in the comment section along with your email address. See, the legs are even, they stay even. That didn't hurt as much that time, did it? Excellent. Hang on one second here. We're still going to adjust his sacrum here for good measure in L5, L4, L3, L2, and there's L1, which you can see the angle of my arm changing the further we got up. Okay, good. Now, let's get you up here. That's all that's moving. Yeah, that's all that's going to. Okay, let's hit you face towards Renee. Okay, now we're going to check his shoulder range of motion now. And adjust his right shoulder first. Got a little bit of grinding crepitus there. There we go, better. You'll feel when you got it in the right spot to adjust the joint properly, and you can also feel it when you do not. So we just make sure we get them in the proper alignment, the proper lines of drive in the adjustment. Then we adjust them and leave them alone. You don't ever want to force things. That's why it's best not to ever let anybody just try this stuff at home unless you have an education or a licensed chiropractor. If you notice, I spend the entire time with the patient treating the patient. I don't send patients off to a therapy room to get electrical muscle stim here or hot packs there. We did it all in here. Let's come back over here, Greg. It's a very focused type of doctor-patient relationship, which we find much more beneficial. Okay, let's have you flex forward and then backwards. Not only for the patient, but for us. See, that was a lot better, wasn't it? Yeah, I'm going to pull that back. Now we're going to do a mirror image. And just a little translation, but not much. His pelvis is right down the gut. There we go. Okay. Now let's try that one more time. Excellent full range of motion. Posture is great. See that squared his shoulders off. They're even now from side to side. Even placement here. How's that feel, Greg?
Feel better every time.
Great. Tell the YouTube fans, if you don't mind, what brought you in here.
I've basically had problems all my life with back pain since 18. I'm 31 now. I've been through physical therapy, cortisone injections, all of that, and nothing seemed to work. And so I saw him on his video on YouTube.
Yep, he's a YouTuber too, guys.
I'm a YouTuber. Hey, gotta have YouTube.
That's
not
right.
everything you want. But
That's it.
I saw something different in Dr. Johnson, and I came in, and it was different, and it changed my life.
Thanks, sir. It's a pleasure having you in here. And
no
anybody that wants to get the new Terminator, just leave your email address on our video, on this video. Thank you. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.